Want to know the difference between local anesthesia and general anesthesia for your plastic surgery case? Well, watch this video to learn more. My name is Sagar Patel and I'm a double board certified facial plastic surgeon here in Beverly Hills. And what I want to do is explain you the difference between the two. So first of all, what is local anesthesia? Local anesthesia is when we inject a liquid substance into an area to completely anesthetize or numb it. This is similar to what happens at your dentist's office, where you'll feel pressure, you shouldn't feel any pain, and it helps decrease the amount of possible bleeding, and most importantly, you can still feel a little bit of temperature. Now, when it comes down to it, this can be combined with an oral sedative medication like Valium or Xanax to help relax you, but for the most part, you'll be wide awake, you'll know what's happening, and you'll have recollection of it. You can go a little bit deeper, but as the deeper you go, you need to be monitored. Now, there's a risk and benefit of going deeper, and there's also a benefit of being more awake. The first thing to know is general anesthesia is on the other end of the spectrum when you're completely asleep. There needs to be a board certified anesthesiologist monitoring you, and you have a ventilator that's helping you breathe. As you're completely paralyzed, you'll have no recollection of the experience. In between that, we have something called IV sedation or Twilight anesthesia, where we simply take an IV and run some medications in there that make you really sleepy to the point where you won't remember it. You'll look like you're feeling it, but you really won't be feeling it that much. Without getting into too much minutia, there's some variations of each of these, like LMA or light anesthesia with some sedation. But for the most part, let's compare the two: local anesthesia, where you're completely awake, and general anesthesia. The first thing to understand is cost. The more asleep you are, the more important it is to have a second doctor in the room who's a board certified anesthesiologist who's monitoring your vital signs. With that comes increased cost. In addition, in that situation, you need to be in a certified operating room. Now, for some people who have severe anxiety or a fear of needles, or have a procedure that's long enough where they won't be able to properly sit still, it's important to be asleep. And to me, these are the important factors. The one thing I would tell you as someone who does 90% of my surgeries under local anesthesia is the surgeon plays a key role in this. For us, adding that extra layer of talking you through the procedure, making sure you're aware and understand what's going into the process is really, really important. If you have a surgeon who doesn't want to be a part of that, there's a lot of surgeons who say everyone needs to undergo general anesthesia, I want to focus on my work. That's totally understandable. So surgeon preference is probably the biggest factor that goes into you deciding what you should do. Now, the other factor that's really important is safety. Some procedures, we want to lower your blood pressure so you don't bleed. An example of this would be a facelift. It's safer to have a lower blood pressure while you're monitored than simply lower it without. And if you're someone with high blood pressure to begin with, it's best to undergo general anesthesia. Now, other procedures, there's another important factor to consider, and that's risk. Not just a risk of bleeding, but a risk of bleeding into your lungs, for example. So a nose job, typically it's important to understand that we want you to be asleep because we want to protect where you're breathing from. If you have bleeding, you want to be able to have a way to protect that bleeding going into your lungs, and that would be having general anesthesia. Now, when it comes down to it, there's certain surgeries where you'll hear and think that's really painful, and that's why you need to undergo a general anesthesia and be asleep. That's not the case. So something like an ear pinning. I hear surgeons all the time, and patients tell me that that surgeon was really expensive because they wanted me to put me to sleep. Now, you tell me, if you can't feel anything behind your ears, you can't see anything, and it takes 20 to 30 minutes per side, there's no reason that every single patient needs to go to sleep. The reason is most likely because the surgeon doesn't want to deal with walking the patient through the process and having to deal with that. And it's worth their time and effort to charge the patient more so that they don't have to deal with it. Whether you're undergoing local anesthesia or general anesthesia, it's really important that you understand the risks of each, you understand the benefits of each. When I do neck liposuction, I prefer it done under local anesthesia. Not because there's more or less risk or more or less cost, but specifically because the patient can help me out. By extending their neck, which is something that we can't do as well by placing things underneath you when you're fully asleep, the patient's able to push out their fat and give me better exposure to it. When people check out my before and afters, like, how do you get better results, Dr. Patel? When I have surgeons ask me, what cannulas am I using to get the results I'm using? I respond by telling you that the answer is the local anesthesia. When the patient helps me, I can get you better results. If you like this video, please leave a comment below, hit the like button, subscribe to this channel. For more content, please leave a comment on what you'd like to see more of. If you have any questions, call our office to book a consultation. Look forward to meeting you soon.